So good afternoon, ma'am. So my report is all about social determinants of health. So my report is part 2 of Ortega's report. So social determinants of health. So pag ito ay tumutukoy sa kondisyon ng tao kung saan sila lumaki, kung saan sila nagtatrabaho, pinanganak, or edad. So these circumstances are shaped by the distribution of health, money, power, resources, and global, national, and local levels. So, ang ibig sabihin nito ay mga pangyayaring hinuhubog sa pamamahagi ng pera, kapangyarihan, at mga mapagkukunan sa pandaigdigan. So, these determinants are mostly responsible for health inequities such as the unfair and avoidable differences in health status seen within and between countries. So, these are the main causes of ill health. So, first is the poverty, social exclusion, poor housing, poor health systems. So, they have also the factors that affect the health of individuals and their communities. So, is determined by the circumstances and environment where they live. So, first, social and economic environment, physical environment, and individual characteristic. So, the structural determinants refers to those factors which lead to stratification such as income, education, occupation, social class, gender, and the last one is ethnicity. So, sustainable development goals on health. So, sustainable development goals on health. World leaders committed to achieve the 17 Sustainable Development Goals or CDG by 2030 in the effort and poverty protect the planet and ensure prosperity for all. So CDG 3 covers the unfinished Millennium Development Goals agenda and newer challenges such as non-communicable disease, health security, tobacco, and injuries. So, as stated by the World Health Organization 2019, the CDG-3 aims to ensure healthy lives and promote well-being for all ages with the following health targets by 2030. So, these are the objective of CDG 3. So, first, to reduce the global maternal mortality ratio to less than 70 per 100 live births. So, second is to end preventable deaths of newborn and children under 5 years of age, reducing neonatal deaths with a minimum of 12 per 1,000 live births and under 5 mortality of deaths at the minimum of 25 per 1,000 live births. So to cease spread communicable disease such as AIDS, tuberculosis, malaria, neglected tropical diseases, and combat hepatitis, waterborne diseases. So fourth, to decrease by the third the premature mortality of deaths through prevention of non-communicable disease. So fifth, the further the promotion of mental health and well-being and reinforcing the prevention and management of substance abuse, narcotic drug abuse, and harmful of alcohol. So, six is to decrease by the 50% the number of global deaths and injuries from road traffic accidents. So 7, to ensure universal access to sexual and productive health care services, particularly family planning, information, and education. So the last one is to attain universal health coverage, especially financial risk protection, access to quality essential health care services including safe, effective, quality, and affordable essential medicine and vaccine for all individuals, and safety for individuals exposed to hazardous chemical and air, water, and soil pollution and contamination. So, Universal Health Care Act or Kalusugan Pangkalahatan was enacted into law Republic Act 11223 on February 20, 2019. So, this law institute UHC for all Filipinos and prescribe reforms in the Philippine healthcare system and the fund retaining to the implementation healthcare in the country. So, summary of this report is health is an essential dimension of human development. It is something that will remain important as influences other domains or of our life. So in this lesson, we reviewed the health means and what are the various factors that are circumstantial to it. So health is an essential dimension of human development. It is something that will remain important that is influences other domains of our life. So define health and is health as an integral condition which is not only absence of disease but presence of well-being. Health is an essential dimension of human development and something that will remain important and influences of other domains of our life. So, look into the position of health in the larger globalization decrease focusing on health-related outcomes, sustainable development. So health is in essential dimension of human development in something that will remain important in or other domains of our life. So provide example how globalization and its impact on health and individual, the family, and community, and explain the various social determinants and health in the Philippines. So tackle the different sustainable development goals that are related to health care. Thank you for listening.